of the following best describes the inheritance pattern of hemophilia B? Okay. A 25-year-old man with a known history of hemophilia B presents to the clinic for a routine follow-up. He reports that he has been adhering to the prescribed prophylactic replacement therapy and has had no recent bleeding episodes. His physician diagnoses the inheritance pattern, discusses the inheritance pattern of hemophilia B with him. Okay. Which describes the inheritance pattern. It's just, to me, this is a memorization. A and B are X. I'm pretty sure there's a song that I think about. It's like a little song, and it goes like A and B are X linked. I don't think it's hemophilia A and B. I just don't. I would go with
So work me through it. So work me through kind of your thought process here. It is a little bit of a memorization thing. Um, First of all, hemophilia A and B, does it have a gender that it likes to be in?
That's a good point. I don't know. I mean, maybe I would assume males.
It is mainly in males. And then if it's usually mainly in males, then what is the pattern of inheritance
It'll be
usually?
most likely X linked of some sort.
Okay.
Um,
So talk me through. Okay, so let's get it down to the X links, okay, because it's mainly in males. Okay, so what's the difference?
so dominant would be every generation. Recessive would skip generations. And I believe in recessive, it would be like you have unaffected parents and then only males would get it.
Okay, so this is a little different. Okay, you're thinking more about autosomal dominant, autosomal recessive. When you're talking about X-linked, remember, right? The way it's genderized is because you have XX and XY for female and male, right?
Hmm.
So if it's X-linked dominant, that means female and male would have the same likelihood of having it. You get what I'm saying?
Yeah.
So which answer do you think it is?
It would be recessive then because if it was dominant, you said they have the same chance.
Yeah.
So yeah.
So X-linked recessive. Okay. And another way to remember that too is a lot of things that are X-linked dominant. Okay. I mean, I can't even come up with a diagnosis because they're so rare. But usually if the male has it, they will probably die in utero
Oh, it's
because
like okay.
yeah, because you don't have a normal X to balance it out, if that makes sense.
Yeah, it's
Right.
just
Just
you're yeah, that one is gone or it's messed up.
exactly, right. And so this goes back to another thing that I want to mention too, since we're already on the topic, is that if for instance, give you like dwarfism, right? What is that, autosomal recessive or dominant?
Dwarfism?
Yep.
It's achondroplasia, autosomal dominant.
Yep, it's autosomal dominant. Okay, so for achondroplasia, and so let's just say you have big A, little a, and then you have somebody born that is has achondroplasia. But did you ever wonder what happens if someone with achondroplasia marries somebody else with achondroplasia?
They can have a if they have any kid or any kid with a double, I guess like the both traits, they'll die in utero.
Exactly. Does it make sense? Because
Yeah.
this is too deadly, right? They have two chromosomes or two I guess alleles, right? Of their genus is both not they're messed up, right? And the dominant is already too it's too strong of a phenotype that putting them homozygous together would be detrimental in utero. So that's why you never see, like, giving you an example, that's why you never see an autosomal dominant disease that is homozygous because those all die in
Hmm.
utero. Make sense?
Okay. Yes, sir. Makes sense.